It is believed that snoring is a phenomenon, which characterizes only men. True, ladies do not suffer anything like that, and just wrinkle their noses and listen to the stories of the friends, as the poor ones suffer from insomnia because of the trills of their second half. Snoring occurs for many reasons. These may be injuries and defects in the structure of the nose, acute and chronic inflammatory diseases of the upper respiratory tract, and benign growths in the nose, throat, and larynx. Smokers can snore due to increased mucus or postponement pitches on the rear wall of the nasopharynx. Most often obese people, who have stepped over the 40-year-old age, snore at night. If you simply make characteristic sounds during sleep, you should not particularly be worried, although a trip to the doctor would not be amiss. But if the snoring is accompanied by respiratory problems, it is better not to delay. This snoring interspersing with periods of latency is called obstructive sleep apnea syndrome. This disease is quite dangerous. Holding your breath, snoring, which carries several hundred times a night, provokes the development of heart diseases, hypertension, and eventually leads to death. In the daytime, the snorer feels unwell too. He is sleepy, suffering difficulties with focusing, headaches and disorders of sexual function. It is clear that these people urgently need to get tested and start treatment for snoring. Many people were helped to get rid of snoring with special drugs. Such medicines are taken for a month, with the same month break. There are special appliances for the nose and mouth, which are used at night. The nasal devices are designed to expand the nasal passages for the air to get better into the respiratory tract. The meaning of oral appliances is that when a foreign body is in the mouth, the tongue will involuntarily touch it, while the soft palate muscles won't be able to relax and block the airway. There is another interesting method of treatment of snoring. The patient puts on a special mask, in which he must sleep. The mask is supplied with air under pressure, which prevents respiratory delays. According to the inventors, the method is effective, but requires long-term or even lifelong use. For those who smoke, it is helpful to gargle olive oil at night. For the procedure, you need only 1 tablespoon. In order to stop snoring, you can also resort to this method. Take 3 cabbage leaves, and properly pound them. You can use a meat grinder. Mix the gruel with a tablespoon of honey, and eat before going to bed. You can drink cabbage juice with honey. This method promises to cure snoring in a month. In conclusion, I would like to remind you that the cessation of breathing in between night roulades is a dangerous sign, and requires immediate consultation with a specialist. Establishing an accurate diagnosis and proper treatment is possible only after a full examination of the patient. Special thanks to Jennifer of Pinky Cloud for providing the reference.